Healthcare in the United States has been a contentious topic for decades. It's a system that profoundly impacts every American, yet remains fraught with challenges and uncertainties. Today we're going to dive deep into the complexities of healthcare in the U.S., the policies shaping it, and why the new Trump administration has me, and perhaps many of you, concerned. Let me start by saying that no healthcare system is perfect. The Affordable Care Act, or ACA, is no exception. But here's the thing, the ACA, often called Obamacare, is more than just a political talking point. It's a piece of legislation that has fundamentally changed how Americans access and pay for healthcare. What bothers me is that during his first term, President Trump made repeated attempts to dismantle the ACA without offering a clear, viable replacement. Back in 2016, President Trump's administration sought to repeal the ACA. Despite numerous attempts, they couldn't fully dismantle it. And why? Because even a Republican-backed Senate understood the necessity of certain protections the ACA provides. That's why I prefer calling it the Affordable Care Act, because its approval wasn't purely partisan. It was a product of compromise. One of the most critical protections under the ACA is preventing insurance companies from charging higher premiums based solely on pre-existing conditions. Think about it. Whether you're rich or poor, do you really want to pay more for health insurance just because of something beyond your control? I sure don't. This should worry everyone. Science is advancing rapidly, and with it comes the ability for insurers to fine-tune risk assessments. Imagine a future where your premiums are calculated not just by your age or lifestyle, but by your family history, your blood work, and even your genetic predisposition to certain diseases. It's not science fiction, it's the path we're heading down. In 2017, it was Senator John McCain who famously blocked a repeal of the ACA. His vote was a pivotal moment that preserved these protections. But now, with the potential for a more unified Republican government under President Trump, that kind of check may not exist. Many people rally behind slogans like "Make America Great Again," but here's the irony. The policies some support under that banner could lead to a sicker America. Removing these protections doesn't just affect those with existing health conditions. It sets a precedent for a healthcare system that prioritizes profit over people. Other nations have found ways to balance costs while ensuring access to care. Yet, here in the United States, we're still debating whether basic protections should even exist. It's easy to get caught up in the politics, but at the heart of this debate are real people. People who depend on insulin to live, families burdened by unexpected medical bills, and seniors who can't afford their prescriptions. Healthcare isn't a privilege, it's a necessity. And while the ACA isn't perfect, dismantling it without a plan is not the solution. We need policies that expand access, lower costs, and protect everyone, regardless of their medical history. Let's also consider the broader landscape of healthcare in America. The costs are astronomical. Did you know that the United States spends more on healthcare per capita than any other developed nation, yet ranks poorly in key health outcomes? For instance, our life expectancy is lower and our infant mortality rate is higher than in countries like Japan, Germany, or the UK. How did we get here? It's rooted in a system built around employer-based insurance which dates back to World War II. Over the decades, the patchwork approach has created gaps in coverage and affordability. Around 28 million Americans still lack health insurance, and for those who are insured, surprise medical bills and rising prescription drug costs create financial strain. Pharmaceutical companies play a significant role in this, pricing life-saving drugs out of reach for many families. Meanwhile, other countries negotiate drug prices or provide universal healthcare to reduce costs. Why can't we? One answer is lobbying by powerful industries that profit from the status quo. But it's not all bad news. Advances in technology like telemedicine and precision medicine offer hope. These innovations can improve outcomes and make healthcare more efficient. The challenge is ensuring they're accessible and affordable for everyone. We also face an aging population which will put tremendous pressure on Medicare and other systems. Without reforms, we risk a crisis in elder care. Thanks for watching. If you found this video informative, please like, share, and subscribe. Let's keep the conversation going in the comments below. What changes do you want to see in our healthcare system?